Now, the Medical Laboratory Science Council of Nigeria has unveiled its accreditation service as an associate member of International Laboratory Accreditation Corporation, ILAC. Now, the Honorable Minister of State for Health presented the accreditation certificate in Abuja. KAFTAN's correspondent was there and now reports.
The rise in the number of unqualified laboratories in the country has been considered alarming and termed a setback to the medical profession. As such, the need for accredited laboratory or well-qualified personnel are truly needed in the country. In spite of this, the Medical Laboratory Science Council held its national conference to address the rate of unprofessionalism conducted by laboratories across the country. The chairman, Professor Mohammed Wazo, in his opening remarks spoke on the essence of the event and why accreditation of laboratories is termed important.
The Council Management granted approval for ISO 15189, Accreditation of National Tuberculosis Reference Laboratories, Zaria, Kaduna State, following a comprehensive accreditation assessment report. Therefore, let me congratulate the National Tuberculosis Reference Laboratory, Zaria, for joining the league of ISO 15189 accreditation, accredited facilities in the country, and to enjoin other government-owned medical laboratories across the country to embrace accreditation as a means of demonstrating their technical competence, especially at the world battles to contain the ravaging COVID-19 pandemic. Let me see this opportunity to request the Federal Minister of Health to come up with policy that will compel all medical laboratories in Nigeria to key into the Medical Accreditation and Medical Laboratory Science Council accreditation program, which will enhance their technical competence.
In their words, the Registrar, CEO MLSCN, Dr. Tosin Erabo, alongside the Director and National Coordinator, National Tuberculosis, Leprosy and Burley Ulcer Control Program, Dr. Chukuma Anyeke, noted that accreditation is mandatory in moving forward laboratory competency, both locally and internationally.
With meeting international best practices, Nigeria has adopted the ISO 15189-2012 as medical laboratories as a national industrial standard for accreditation of public and private medical laboratories in Nigeria. These standards covers in vitro diagnostics, regulation, infrastructure, human resources, equipment, and quality management system. MLSCN has also developed a number of regulatory guidelines and protocol for inspection of medical laboratories in order to support and strengthen the accreditation program.
All know the importance of laboratory medicine. They are there to give us accurate diagnosis for effective and efficient treatment. So it's a very important part of medical practice, because when you get the accurate diagnosis, in fact you have solved 50% of the problem, then you place appropriate treatment to be able to run to absolute cure of that ailment.
The guest speaker, the Honorable Minister of State for Health, Olorunnibe Mamora, gave his words on the importance of proper diagnosis in a well-accredited laboratory.
As practitioners of medicine, we know that the outcome of any disease process, or what we call the prognosis, is a function of two factors. The first is early diagnosis, and the second is prompt treatment. That's why these days you can manage a number of cancers if detected very early. Yes, in clinical medicine you make clinical diagnosis. But oftentimes you need to go on to laboratory diagnosis. And that's why even now you have what we call laboratory medicine. Because you cannot treat effectively what you don't know. And that's why the medical laboratory science is very, very important.
The Honorable Minister thereafter unveiled the Medical Laboratory Science Council of Nigeria Accreditation Service as an associate member of ALEC and presented the National ISO Certificate of Accreditation.